Doctors of naturopathic medicine like to say that traditional doctors of naturopathy have less education and are not fit to take care of your health. Priests train for years to become priests, whether Catholic or Buddhist or a rabbi. But there are other spiritual leaders. Maybe they went to Bible college or just have a gift, like Dr. Martin Luther King. Was Martin Luther King deficient because he was not a priest? Your minister may have inspired you and guided your children competently while being part of the community, not a schooled elite group living apart from the community. Ministers have a different approach, which is why we have different types of leaders for different faiths, and we wouldn't have it any other way. Kids love to play football. Maybe they'll play in college. But professional football is big business. Sorry, kids, you can't play because somebody might mix you up with professionals. So that brings us back to the modern doctor of naturopathic medicine. The 5 U.S. schools approved by the Council on Naturopathic Medical Education have adopted a format similar to mainstream allopathic medical schools. As these pictures from Sonoran University in Arizona show, pretty indistinguishable. And here's the goal, according to the Dean of the College of Naturopathic Medicine there. Give patients the best outcome with training in both allopathic and traditional naturopathic therapeutics. They brag about this. We teach these therapies. Injection therapies, IV therapies, minor surgery, pharmacotherapy. That's synthetic drugs to you? Is that what someone wants when they consult a naturopath? The modern naturopathic doctor is now being increasingly referred to as NMD, Doctor of Naturopathic Medicine. But what about the classic ND, the Doctor of Naturopathy? NDs study corrective diet, light therapy, hydrotherapy, manual therapies, corrective exercises, botanical medicines, homeopathic remedies, vitamins, and more. And none of these requires conventional medical studies. In fact, being like a medical doctor actually hinders the ability to effectively apply these methods for many people. Classic naturopathic doctors feel no need to go outside their philosophy or training. They just continue to use their time-tested methods to help people get well, which has nothing to do with where they went to school. The rest of the world mostly has this attitude toward natural medicine. Why do we have such a political problem in the United States where one small group wants to ban a much larger group? The struggle for the stethoscope goes on. You may have heard some of the attempts to diminish doctors of naturopathy by calling them traditional naturopaths. Why not original naturopaths or genuine naturopaths? And by calling them lay naturopaths in states where they're barred from licensure, this suggests they are untrained and dangerous. A ridiculous slander because they are trained. They are trained in original naturopathy. If there is danger, I'd say it's more likely to reside in someone who says he's had the equivalent training to a medical doctor in addition to training in naturopathy. Anyone who stops and thinks will realize that no one can master conventional medicine and natural medicine in the same length of time it takes for either one alone. Don't be fooled by propaganda. I'm C.P. Negri for the American Naturopathic Association.